people make a determination about you within the first 30 seconds. Are you friendly? Are you helpful? Are you not? Are you on their side? It's important to sit down when you talk to a patient. People feel like that you're listening to them more and less rushed, that you spend more time with them if you're sitting versus standing. And these are legitimate things because you want to do it. And then I ask them, okay, why are you here? And they give me their list, and I hear their list, and I repeat it back to them. And then I tell them, okay, I hear this, and this is what I need to focus on. And for this other issue, I'm going to have you talk to X, Y, and Z, but I will be focusing on this. And then they tell me their story, and you just have to respond sort of with empathy, both verbal and nonverbal ways of empathy. And there's little skills you can do with that. And then once you're done and you've formed your assessment of what needs to be done to help the patient, you want to, what they call chunk and check. You want to divide up all that information, all that medical information to a level they can understand. So, don't talk to people like they're all doctors, right? Even to my doctor patients, I'll say to them, I know you're a doctor, but I'm going to treat you just like a patient because that's how I want to be treated, like a patient. Unless you tell me otherwise, I'll talk to you like a patient. And 9.9 times out of 10, like, yes, because they're not breast imagers and they're scared and they might hear the word biopsy or something like that. And they just want to get the basics. So then you do a chunk and check where you break it down into what we call ask, respond, and tell. So you can break down the information into these small things, and it's more of a conversation versus what I call a download. And then you want to make sure they understand what you've said, and that would be the teach back, which is something nurses have done for years, but it's newer for doctors. And just to make sure, I'll never say to someone, do you understand what I just said? But just rather say, I just gave you a lot of information. Please let me know that I did a good enough job explaining it to you. Tell me your understanding of things. That was a lot
Yeah.
of information, but that's the general gist.